Next is the perforating cutaneous nerve, also known as the inferior cluneal nerve. The inferior cluneal nerve has a cutaneous innervation to the medial aspect of the gluteus, so in this area here. That is your inferior cluneal nerve. There is also a superior cluneal nerve, and the superior cluneal nerve innervates the lateral aspect of this gluteal region. So it would be all of this. So this is your superior cluneal nerve, and this is the inferior cluneal nerve. Next we have the pudendal nerve. The pudendal nerve has three main branches. The inferior rectal or inferior anal nerve, same thing. The peroneal nerve and the dorsal nerve of the penis or clitoris, males, females. The inferior rectal anal nerve has a motor or sensory innervation to the external anal sphincter, a skeletal muscle. It has a cutaneous innervation to the perianal skin, which is the skin around the anus. The peroneal nerve has a motor and sensory innervation to the muscles of the urogenital triangle, and has a cutaneous innervation to the skin of the posterior scrotum in males or the labia majora in females. And finally, the dorsal nerve of penis or clitoris, as its name says, only has a cutaneous innervation to those areas. So here's a diagram to make it clear. We have the pudendal nerve coming down, and this is a male, so it comes down and gives off the three main branches. Here's the dorsal nerve of the penis, the middle one here. This is your perineal nerve. The perineal nerve comes down and innervates the posterior aspect of the scrotum. And here's your inferior rectal nerve that goes to the rectum. The femoral nerve innervates the following skeletal muscles: iliacus, pectineus, sartorius, and the quadriceps femoris. The quadriceps femoris includes rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. All of these muscles innervated by the femoral nerves, motor and sensory branches. The cutaneous branch, it has three cutaneous branches. The first is called the anterior cutaneous nerve of thigh, also known as the intermediate cutaneous nerve of thigh. The innervation is, as its name says, is on the anterior aspect of the thigh, so it would be all of this area here, except maybe just get rid of here, this. This is your anterior cutaneous nerve of the thigh. The second cutaneous branch is the saphenous nerve. Saphenous nerve innervates the medial aspect of the leg and foot, so it is in this area here. Okay, we had anterior cutaneous nerve of thigh, saphenous nerve. The third cutaneous branch of femoral nerve is the medial cutaneous nerve of thigh, and again, like its name says, it's on the medial aspect of the thigh, and it would be usually just this medial portion here. You cannot see it because this is not a lateral view, but it would be on this. It's not the entire length, as you'll see, because the upper half is the obturator nerve, so it's mainly usually around this lower half. So looking from the posterior, you can see it's the lower medial half. Okay, so we have the saphenous nerve, anterior cutaneous nerve, and the medial cutaneous nerve. The next nerve is the obturator nerve. Has a motor sensory innervation to the skeletal muscles called gracilis, adductor brevis, adductor longus, obturator externus, and the adductor magnus. It has a cutaneous innervation called cutaneous branch of obturator nerve. The cutaneous branch of obturator nerve innervates the upper half of the medial aspect of the thigh, so this area here. And same thing here. So the lower half was the medial cutaneous nerve of the thigh from the femoral nerve. The upper half is the cutaneous branch of the obturator nerve. So this diagram here is showing the spatial relationship of the muscles we've just covered. So here you have the femur, patella, tibia, and the fibula. Because the fibula is on this side, it means that here is our lateral side and this is our medial side. The three muscles here are the rectus femoris in the center, vastus lateralis on the lateral side, and vastus medialis on the medial side. The vastus intermedius runs beneath the rectus femoris. All four muscles make up the quadriceps muscles and are used to extend the leg. There's also three additional muscles in this area. These are the sartorius, gracilis, and semitendinosus muscles. All three muscles attach within the area of the medial epicondyle of the tibia. The order of attachment is shown here. We have the most superior, sartorius, the one in the middle, gracilis, and the most inferior, semitendinosus. You can make sure that each attachment corresponds to each muscle by following each muscle superiorly. The sartorius muscle is going to continue superiorly and then go laterally to attach to the anterior superior iliac spine. The gracilis is going to go straight superiorly upwards and going to attach the pubic tubercles, and the semitendinosus is going to curve posteriorly and run along the posterior aspect of the thigh. So once again, as a quick review, we had up here in the gluteal region the inferior cluneal nerve, the superior cluneal nerve, and then down here in the thigh we had the posterior cutaneous nerve of thigh, lateral cutaneous nerve of thigh, and on the medial side the lower half is the medial cutaneous nerve of thigh, and the upper half is the cutaneous branch of obturator nerve. Down into the leg you can see the saphenous nerve, which innervates the medial aspect of the leg and the foot. If you see a look at it from the anterior view, we have the lateral cutaneous nerve of thigh, anterior cutaneous nerve of thigh. Here is your obturator nerve, and here is the medial cutaneous nerve of thigh. And then again you see the saphenous nerve innervating the medial aspect of the leg and foot. Both here and here are saphenous nerves.